Hello everyone. Today we're going to talk about depression, an illness that affects hundreds and thousands of people all over the world. I have with me Dr. Yasser Abbasi, consultant psychiatrist and head of addiction services at Maudsley Health Makani. Dr. Yasser, what is depression?
So thank you for having me. Depression is a very complex illness. It's a collection of many symptoms which leads up to people feeling really low in themselves. It is quite a serious illness. It affects quite a lot of people, both men and women. Some statistics suggest that it can affect 1 in 4 people, mental health problems, and out of them a lot of people can experience depression. People can get so depressed that sometimes they end up taking their life. So it is a serious illness which needs to be treated and addressed properly.
As a non-clinical person, how can I spot signs in my family members or my loved ones?
That's such a good point. We would like to see what's happening around us to our loved ones. But if someone's developing depression, they will have a series of symptoms, not just feeling low. So you would start feeling low in yourself, you'll be more tearful, your appetite would reduce, sometimes it might increase excessively, you might start losing weight, you might gain weight if you're eating more, but it will go in extremes. And also you develop a symptom called anhedonia, which means the inability to experience joy. You don't enjoy things that you normally do, and on top of that, you might start feeling worthless and hopeless. And the hopelessness goes to such an extreme that it leads up to someone wanting to end their lives. But you have to have, the most important thing is you have to have these symptoms, at least 3 or 4 of these symptoms consistently for 2 weeks or more. That is when you start becoming concerned. Before that, you naturally keep a close eye on it. But if it's consistently there for 2 weeks and more, that is when you think, well, you know what, they need treatment.
Which brings me to my next question. What can I do to help?
When we find someone we love experiencing these symptoms, is to make sure we approach them in an empathic manner, which means you are approaching them in a non-judgmental manner. There's no point in telling them why you're feeling depressed and you have everything, there's no reason for you to feel low, because it happens, and it happens to anyone. It can happen to you, it can happen to me. So you approach them in a non-judgmental manner. You will help them engage in activities that they used to like. Take them out for a walk, for a run if they like doing that, or for a swim, or whatever activities which suits you and them. You also try and make sure that you are able to hear them out. So they've got a listening ear, so they can talk their problems out to you. And lastly, if you feel, as mentioned, that if the symptoms are lasting for 2 weeks or more, that you are supporting them to seek professional help. They need to go and see a doctor, they might need medication, they might need psychological help, they might need help from social workers as well. So getting an overall care for the problem and illness. So it is an illness which needs treatment, which needs attention, and which needs your support as well.
Thank you very much. Thank you for listening to us. If you have any questions, please post them in the comments and we will try to get back to you. Thank you. Stay safe.